With tummy tucks, there's two major types. There's the mini, which really just addresses that lower portion of the abdomen, versus a full tummy tuck, which goes all the way up to the ribs and really tightens your entire stomach and then brings those six-pack muscles. It's called Diastasis Recti. It brings those muscles back together. It's one of the most common procedures we do here. The most common being a full tummy tuck, but certain select patients are candidates for mini tummy tucks that can actually be completed in the office. When we do a full tummy tuck, really the one thing that kind of sets us apart is I'm a board certified plastic surgeon. We do not use drains. I have not been using drains for probably the last 5 years for tummy tucks, which is really, in my opinion, the way everybody should do it. It decreases the risk of hematoma, which is blood collections. It decreases the risk of seroma. I get better scars. I get better results. And overall, your long-term outcome, in my opinion, is quite a bit better doing it that way. And you don't have to have the drains. Who wants to walk around with tubes coming out for a period of time? We also have the option of keeping you overnight, which is a nice advantage. Call today and we'd be happy to see you for a consultation.